Hello, everyone. Thank you again for coming back. I have no idea what the temperature is like where you're living, but I'm in Washington, D.C., and it has been a very hot day. And on top of that, my AC is on the blink. But anyway, we're here again tonight to enjoy our time together, to learn more information, and to really learn more about the healthcare system. This is my second episode in terms of knowing providers, understanding the health system a bit so that you can make wise decisions about who is going to be the person you hire to care for you during your pregnancy and birth experience. Last night we talked about midwives, and tonight we're going to talk about doctors. How did you find your doctor? For those of you who have OBGYNs, a lot of us are getting GYN care. How'd you find your doctor? Or midwife, by the way. Family, friends, referrals? How'd you find them? Well, let's talk more about that because there are different ways to be able to find doctors and different ways to find out about their practice. What I'd like to do is to also show you that if you're going into I would say, the teaching hospitals where there's loads of people, loads of hustle bustle to understand who's what, who's who, where they come, where they go, all of that. Depending on where you live, if you are in a rural area, then you likely will not be at a teaching hospital. And so usually the doctor that you see will be the doctor who will follow you into the hospital for labor and birth. That would be it. That's your attending physician. Now, if for some reason you live more in the urban city area, then there's likely more teaching hospitals around. And the teaching hospitals are going to have loads of people. So when you are admitted to the hospital, there might be an army of folks who show up in your room that you may or may not have expected or may not want to be in your room at the time you're giving birth. So I want to, one more time, just throw up a slide for a reference point to look at all of these different types of doctors, and so that you understand, you always have the right to ask people their names. Who are they? If you don't know them, you also have the right as a paying person to decide who you want to be at the birth of your baby. That is a very private event for some families and couples. And so it's your birth, right? Not theirs. So I'm going to throw up the slides one more time and we're going to walk through this. The thing I want you to know is that this does not apply just to OBGYN. This applies to every discipline. It's possible that you could be in the hospital for different reasons. And particularly, I'm going to talk mainly in teaching hospitals. So it's important to know when you go to the emergency room, even at the community hospitals, now they may have what's called hospitalists. And these hospitalists are doctors who are paid to come on a rotating shift to be able to take care of people that are in the hospital. They are supposed to communicate with your doctor, but they're not supposed to replace your doctor. You're paying for your doctor. That's who is your attending physician. And sometimes you may have to have some conversation about that. So let's talk particularly in terms of OBGYN. The perinatologist is like the expert in everything. He is an OBGYN. He or she, they have gone back, they have continued their education in maternal fetal medicine so that they can take care of high-risk women in pregnancy. So if an OBGYN is seeing you and you start to have problems that they themselves feel that they cannot handle, they will refer you up to the perinatologist. And it's also your right to ask to be seen by a perinatologist if you are concerned that you're having medical problems in your pregnancy that you want an expert to take a look at. Sometimes it's a consultation only, and sometimes the perinatologist could actually be your attending doctor. Now let's look at your OBGYN. Your OBGYN is someone who has finished medical, they've done their undergraduate, gotten a bachelor's degree, they've gone to medical school, and when you finish medical school, that's where you get MD. It's a degree, it's a doctor of medicine. Then you will then proceed to study in the area that you want to specialize in. So for OBGYN doctors, they have finished medical school and then they need to do 4 more years of residency. And residency is where they are training in classes, lectures, but also taking care of patients. There are 4 years. And so you have year 1 resident, year 2 resident, year 3 resident, and year 4 residents. Below the residents, you have your medical students. These are individuals who have gotten their bachelor's degree and have gone on to medical school. And with medical school, they're getting a doctorate in medicine. So when they finish their 4 years of medical school, they are getting a degree that is the doctorate in medicine. So think of this now. When you are a medical student, you're pretty much doing things such as taking physical examinations. You might be involved with some procedures, but you have probably done very few, if any, births, okay? Where you are the main person assisting this woman with the birth of her child. Now, how the timing goes for moving from a medical student to a resident, first-year resident, my experience is that the school year ends June 30th, and July 1st, they are now the first-year resident. Now, if you are going to a teaching hospital where your attending doctor does not have what we call admitting privileges, meaning that they do not have a relationship with that hospital where they are able to follow you, then you then become the patient of the residents. That may or may not be a good thing. And it's something that when you look at your doctors, you want to find out what hospitals are they affiliated with, so that if for some reason in an emergency or whatever, you end up at a hospital where they are not the attending and do not have a relationship, you can expect that you will then be the patient of the resident staff. The other thing to know is that I've gone from a medical student on June 30th to the first-year resident on July 1st. That first-year resident could possibly be the person to deliver your baby. They are the least experienced. And when we look at what are the maternal death causes, some of this in terms of postpartum hemorrhage, some of all of these things in terms of management, some of the results can be from lack of experience. Your second-year resident is also one who's usually very involved with the births. So you want to know when you go into the hospital to be able to identify who all of these people are. Who is taking care of you? Does your attending doctor have privileges at that hospital? And if so, you want to be taken care of by your attending doctor. What can happen sometimes is that if your doctor is tied up, he may ask one of those doctors to see you for him or her. but they are to report back to your attending doctor so that they are able to take over your care. Again, this does not occur only in OBGYN. This occurs in all disciplines. So as you're thinking about who is going to take care of you during your pregnancy and birth, who are you going to hire for your provider for pregnancy and birth to guide you through that? You must think of all of these things. Now, how can you find someone? We talked about what happens is often you'll get referrals from friends and family. That's great. But your friends and family may have had a different birth experience than what you desire. And so you still want to do your own homework. I have sometimes called the hospital and asked to speak to the nurses on labor and delivery and say, I'm new in town and I just want to find out who you might recommend for an OBGYN and why. And why. They work with these individuals every day. They see how they treat their patients. They see how they do with cesarean sections, how they manage and work with their patients. So that's one other way. You can go on Google and search. I did that prior to our meeting tonight. Get loads of names. Search for in your city or where you live. Yelp is another place where you get consumer reviews in terms of what patients thought about these particular providers. It helps to give you some background information. There are different magazines that are put out by different localities. In Washington, D.C., it's called the Washingtonian Magazine. So you might want to see what city you live in. What is that magazine called? Because every year they feature the top docs in that city. When I'm looking for a new physician, I go to U.S. News and World Report, their best doctors. And what they will do is list them, and they are listed by city. You can put in the city and it will bring up the list of doctors and then their stars by patient, not only patient, but also other physicians' recommendations. TopDoctors is another location that you can go to find a very good physician. And then DocInfo, if you want to look up where did they go to school, what is their license, their professional background, you can go to docinfo.com and find out more information about the doctor that you're interested in going to. So this is one more layer to understanding the healthcare system, where you can find out information, do research on the doctor and also the midwife that you would want to work with or hire again as your provider during pregnancy and birth. And you can do this for every discipline, whether it's general medicine, internal medicine, pediatrics, same thing. You should do this for pediatrics as well, so that you can have your pediatrician lined up and not just take the recommendation that your doctor gives. Because sometimes these practices are working together and keeping all the business within their own practice. And you have the right with your insurance to go anywhere and hire anyone you want. Keep in mind, we will go out and get 3 bids if we need an electrician to come to our house. We will go out and get 3 bids if we need a contractor for anything around our house. Why are we not doing this when we're looking for healthcare providers? To go out and get some sense as to what are their reviews from others, how much do they cost, what is their track record like. So this is why I'm bringing this information to you, so that you can begin making decisions and actually going out and doing interviews with these individuals to make a decision as to who you want to hire to guide you through the pregnancy and birth experience. Tomorrow, we're going to talk about different types of hospitals so that you can understand all these different types of hospitals. It's important to look at what are their cesarean section rates. Where can you find that information? Are they baby-friendly hospitals, meaning that are they going to not try to introduce bottle milk to your baby if you're trying to breastfeed exclusively? So we're going to look at hospitals tomorrow. Again, I hope you have enjoyed what we have given you tonight. If you have any questions, please put it in the chat or email me. I have enjoyed my time one more time. I am going to be coming out with an ebook very soon that I hope you'll find informative and helpful for you. And have a great evening. Please subscribe to my page. Please like me and share me with your friends, families, sisters, brothers, mothers, fathers, aunts, uncles, nieces, and nephews. Have a really, really great evening. Thank you for your time. One more time. Thank you. Have a good night. Bye-bye.